Hello and welcome to the topic Reactive Arthritis in the Rheumatology module. By the end of this topic, you should be able to define reactive arthritis, outline the causes and pathophysiology, discuss the features of reactive arthritis, describe the investigations that can be done, and finally explain the management of reactive arthritis. Let's get started. Reactive arthritis is defined as an arthritis that develops following an infection where the organism cannot be recovered from the joint. It is one of the HLA-B27 associated seronegative spondyloarthropathies. It encompasses what was formerly called writer's syndrome, a term which is no longer in use. This arthritis is described by a classic triad of urethritis, conjunctivitis, and arthritis following a dysenteric illness during the Second World War. Later studies identified patients who developed symptoms following a sexually transmitted infection, post-STI, now sometimes referred to as sexually acquired reactive arthritis. You may wonder, what could be the cause of reactive arthritis? Well, there are a few occasions. This table shows the organisms that are most commonly associated with reactive arthritis. We have the post-dysenteric form, which is caused by, of course, organisms that cause dysentery such as Shigella, Salmonella, Yersinia, and Campylobacter, and the other type, which is post-sexually transmitted infection form, usually caused by chlamydia. Reactive arthritis can develop after a sexually transmitted infection like chlamydia or after gastroenteritis caused by bacteria like Salmonella, Shigella, Yersinia, Campylobacter, and E. coli. These are bacteria that are all gram-negative, so they have molecules on their outer surface called lipopolysaccharides. These molecules produce a strong immune response, so much so that their other name is endotoxin. Also, most individuals with reactive arthritis have the specific gene HLA-B27, which is one of many genes that contains code to make MHC class 1 receptors. Exactly how reactive arthritis develops is unclear, but it probably has to do with the way that highly reactive lipopolysaccharides react with the MHC molecules on a cell surface. Because the immune system takes a while to present foreign antigens and kick T cells into action, reactive arthritis often starts 2 to 3 weeks after an initial infection. Tissues usually targeted by the immune system are tissues of the joint spaces, but occasionally the immune system also attacks tissues like the lining of the urethra and the conjunctiva. As for the time course, this form of arthritis typically develops within 4 weeks of initial infection. Symptoms generally last around 4 to 6 months. Around 25% of patients have recurrent episodes, while 10% of patients develop chronic disease. Reactive arthritis typically develops within 4 weeks of initial infection. Symptoms generally last around 4 to 6 months. Arthritis is typically an asymmetrical oligoarthritis of the lower limbs, mainly affecting the large weight-bearing joints, usually the knee and the ankles. There also will be presence of dactylitis, symptoms of urethritis. In the eyes, you might see conjunctivitis as well as anterior uveitis. And as far as the skin lesions are concerned, one may have circinate balanitis, which is painless vesicles on the coronal margin of the prepuce, as well as keratoderma blenorrhegica, which is a waxy yellow or brown papules on palms and soles. Reactive arthritis is usually diagnosed based on the history of previous infection and clinical examination. The testing done for reactive arthritis is the HLA-B27 gene, which is often positive in those with reactive arthritis. As for management, this condition is usually self-limiting. However, for symptomatic relief, one may be prescribed analgesics as well as NSAIDs as part of analgesics and intra-articular steroids. Sulfasalazine and methotrexate are sometimes given, and this is used for persistent disease. And as for prevention, antibiotics given at the time of non-gonococcal venereal infection will reduce the likelihood of that person developing reactive arthritis. Appropriate treatment during the acute stage would be doxycycline 100 mg twice daily if chlamydia infection is confirmed. Now let's summarize. Reactive arthritis is when an infection triggers joint inflammation somewhere else in the body, usually involving a single large joint. Typically, the initial infection happens in the genitourinary tract or the gastrointestinal system. The gene HLA-B27 is present in most individuals. Diagnosis is made on history and examination, and treatment is with antibiotics during the acute infection, as well as anti-inflammatory medications are given for pain management. We have come to the end of this topic. Thank you.